Good evening everybody, and welcome to our third It's a Pain lecture, which is entitled Could Medicinal Plants Manage Pain? And it's going to be led by Ross Menzies. I'm Joanna Quinlan, and I'm responsible for the lecture series from the NHS side, along with my colleagues Nicola Massingham and Dr. David Laird. And the series is a result of a collaboration between County Durham and Darlington NHS Foundation Trust and also Durham University. Dr. Paul Chazot has been the key person from Durham University, but unfortunately he is unwell at the moment. We wish him a very speedy recovery. And in his place we have Professor Roy Quinlan from the School of Biological Sciences, who will be standing in for Paul today. At the end of the lecture there will be opportunity for you all to ask some questions, and there'll be a few that you can direct that question to, which will include Professor Roy Quinlan, also of course Ross Menzies and Dr. Nicolette Perry, who does research in plants and works at the Physic Garden. Yeah. So just to kind of let you all know as well, we have actually planned our fourth event, which we're changing from our traditional Thursday night to a Wednesday night. So this event is going to be on Wednesday the 24th of April. It's going to be at 7 p.m. and it's also going to be in this lecture theatre, so in the Calman Main Lecture Theatre. It's going to be in the form of a debate or a forum, and we're going to be looking at the sort of provision of pain management services and thinking about that here, so in the North East, in the UK, and also more globally, so across the world, and sort of considering whether it's a basic human right to have good pain management, and thinking about whether we actually have a responsibility to people that live in other countries abroad, such as Africa, for example. And we're also going to think about how we could improve our services here in the North East, and thinking about provision of those services. So there's going to be a panel of people for that debate, and we can tell you that Baroness Hilary Armstrong, who is a non-executive director of the our NHS Foundation Trust, and also a former chief whip of the Labour Party, and also Dr. Kate Bidwell, who is a chair of a commissioning group of North Durham. And we've also got to appoint a few other people to that panel. If you would like to have the opportunity to ask questions to this panel, then please leave your email address, or alternatively you can email me on joanna.quinlan@nhs.net. So yeah, in the next few weeks we'll be sending out an email to invite you to ask questions to this panel, which I'm really excited about. I think it's going to be a really great event. And lastly, if you would like a certificate, if you could please state your names very clearly on the piece of paper at the front there. It's just we've had trouble reading some of them in the past, so if you could just write really clearly, that would be very helpful for us. So with no further delay, I'm just going to invite Ross Menzies to give us our lecture. Ross Menzies is a medical herbalist, and he's been doing this now for 14 years, and he's based up at the Herbal Clinic up in Hexham. So welcome, Ross.
Thank you very much for coming out this evening to listen to me. I hope it's worthwhile. What I want to do is to give you an idea of what a herbalist does, explain a little bit about my work, give you a flavour of herbal medicine, and talk about how I would approach health issues generally, but specifically pain and chronic pain. The medicines I would use and other techniques I would use as part of the process of helping somebody deal with pain. So as we said at the beginning, I've been doing this for quite a while, and whilst I've been working with people, obviously pain is something that usually is present when there's a health problem in one form or another. It's the body's way of telling us there's a problem. and over the time I've been working, I've worked with all sorts of different health problems, and just observed really kind of when people have chronic pain and acute pain, what's going on for the person, what works for them, how I've been able to help them, which medicines have worked really well for them, which ones haven't. So tonight I just want to give you an idea of what I have found really useful and what I've observed in the patients that I've worked with. So that's kind of what I've brought into this lecture this evening. I want to give you some idea also of the philosophical approach of herbal medicine, which is quite different, I think, to that of allopathic or conventional medicine. I think we do have crossovers. And as a herbalist, it doesn't mean that I hate anything that's to do with allopathic medicine. It means that I think herbal medicine's got something really important to offer, but maybe one day if we have a really enlightened health service, we might be able to combine herbal medicine and allopathic medicine and other forms of medicine to give the patient a wide choice and perhaps the best possible resources to restore their state of balance. So hopefully I can kind of differentiate between herbal medicine and allopathic medicine as well. Herbal medicine, I suppose if I was to summarize the way I approach health, I would say that I have a holistic approach, and the word holistic is one that is used an awful lot, and I don't know if we really fully kind of grasp what holistic means. So I'd like to kind of just start by thinking about what does it mean when you say that you work from a holistic perspective as far as health goes. And I suppose for me, when I work with a patient, I'm thinking about that they're completely linked up. Everything is linked up. So the health of that person relates to the health of the cells in their body. It relates to the tissues that those cells make. It relates to the organs that those tissues make up. It relates to them as a person, their personality, how they live their life. It relates to the environment in which they live and what their bodies are exposed to from that environment. It relates to the society in which they live and the pressures and habits that they evolve as a result of living in that society and the values of that society. So I think the health of the person relates to all of those things. I think in our conventional medicine we tend to specialize, and I think that's got real values because it means people really can understand in great depth about particular organs or particular systems of the body. But I think what it lacks is that ability to really step back and see how everything links together. And I think that's what a more holistic approach can really bring to a health problem. So nothing is separate. And just as a really brief example, if you think about, say, somebody has a digestive problem, so they come to me with a digestive problem, they maybe got some pain and some cramping. And so I would start maybe by thinking about what the symptoms are. That would give me some idea what's going on. And then I would talk to them about their diet. And then I would talk to them about their lifestyle maybe. And I might find there's a lot of stress in their life, which is causing their digestive system to not work properly. And they might be eating the best food in the world, but because they're stressed, they're not digesting it. And that's causing stomach problems, which means then the food's not digested properly, which then might have a knock-on effect to the bowel, and the bowel might stop working properly, which means the toxins might build up in the body, and then all sorts of other problems can stem. So someone can come along to me with quite a confused picture of symptoms that could all stem from originally a stressful life and a digestive problem. So to just throw some pills to settle down the digestive problem would miss out on the whole understanding of what was going on. So I would need to look at the person's whole lifestyle to understand what was going on with that. So an acute problem could turn into a chronic problem. And I think as far as pain goes, we're perhaps more interested in the more chronic pain than acute pain. If we're looking at acute pain, obviously that's a short-lived thing and it demands fairly quick action and usually resolves itself. Chronic is more problematic, more complex, and more likely to involve all different aspects of the person's life. So let's have a little analogy which maybe helps to explain something about what I mean by holistic, and also what I might be looking for with symptoms. So I want you to imagine that you're setting off in your car and you're driving from Durham to London, and you set off in the morning, head off down the motorway. You've just got onto the A1 and the oil warning light comes on in your car, So imagine you've got 3 choices. You can either just think, okay, I'm not going to worry about it, I'm just going to hope I get there, there's only another 350 miles to go, or whatever it is. Hopefully my car can cope and I'll arrive safely in London. So that's your first choice. Your second choice is to reach into your pocket or your glove box and take out some black sticky tape and put it over the oil warning light so you can't see it. So at least you don't have to think about it and carry on driving. Or your third choice is to think, okay, that could be something quite serious. I really ought to pull over at the next service station, call the AA, or if you're a mechanic, sort it yourself, but just get some advice on why this light's come on. So if we're thinking about a car, probably we'd all come to the conclusion that the sensible thing to do would be to understand why the oil warning light has come on and what it's telling us and what we need to do to resolve that problem. When it comes to our bodies, I think sometimes we tend not to do that. So if, for example, we've got a pain or some kind of sign that things are not quite right, we might just reach for something to get rid of that. You know, you can, painkillers, whatever it might be, or there's an advert on telly sometimes for if you've got flu, reach for the Lemsip that's also got caffeine in it, and you know, paracetamol and all sorts of those, just so you can keep going. That's kind of analogous to carrying on driving and ignoring the oil warning light, really. We just keep going and don't worry about all these different signs and symptoms that our body is trying to make us understand, and hope you get there. So yeah, the sensible thing to do is to step back and understand what the body is trying to tell you. And if you don't do that, something quite minor might become something more chronic down the line. So if, for example, I mentioned flu, you keep getting flus and colds, but you just keep going and you don't rest, then the body gets more and more and more depleted. And eventually it will say, hang on a minute, I've given you enough signs, you still haven't slowed down, you're still out partying all night and drinking loads, and you know, not that I'm against parties and having a drink or having a good time, but if your body's telling you you're doing too much of that, then you need to maybe step back and reflect on it. And if you don't, something will become more and more chronic. So minor things can lay the foundations for more chronic things if we don't respond to them in the right way. And I think sometimes our medical system and our culture and our work culture and our, you know, just the way we live encourages us to ignore our body's signs that things are not quite right and keep going and suppress symptoms or mask them, sticking bits of black tape over our warning lights, so that we can carry on. So if we're having symptoms in a more holistic approach, or from any approach really, it's the body's way of telling us that we have some kind of imbalance and we need to make some changes. It's not really that we just want to get rid of those symptoms. That's not what they're there for. They're there to tell us something, whatever they may be. So let's think about pain then. So as I say, this is based upon working with people over the last 14 years or so. And pain, as I said at the beginning, is an indicator of a wide range of imbalances and problems. Often physical. There can be physical problems, and pain is the body's way of telling you there's an imbalance. But also psychological issues can eventually, I think, reflect themselves in the body as physical pain as well. And I mentioned acute pain. It comes on quickly. It can be a sign that you need to deal with something fairly urgently. But chronic pain is the more ongoing problem. And what I think herbal medicine is able to do is to take the time. A herbalist would take the time, would have the time available because to work with somebody and begin to try and unravel all the threads behind that chronic pain. You know, it could be that there's something really obvious biological or biochemical problem, and it may be that allopathic medicine can be the best way of resolving that. But in my experience, if there's chronic pain, and particularly if it can't be put down to any obvious factor and it's more generalized, it can relate to a lot of non-physical things. Just what I've observed in people. It can relate to stress. It can relate to people living lives that are out of balance with what their beings and their bodies need to be doing. It can relate to whether a person's being really authentic with themselves, is what I've observed. Are they living the life they really want to be living, or are they in a place in their life where they really don't want to be, but they're just ignoring that. And I think what can happen is that in the same way, if you ignore more minor signs and symptoms, they can become more chronic. I think it also works on a non-physical level. If you ignore nagging feelings or things that you need to change something in your life and you keep going, or you're not happy with your job, or your relationship's not right, or whatever it might be, it can express itself eventually in physical symptoms, one of those being pain. So I find when I work with people who've got chronic pain, quite often you'll find that they've got lives that are, there's some difficult issues there. I mean, life does raise difficult issues for everybody, but I think if it's expressing itself in a chronic health problem, there may be some complicated things in that person's life to work through it. And so as a herbalist, when I work with people, yes, I will prescribe some medicines. I'm going to come on to those medicines in a bit. I know I haven't said much about plants yet, but I will. But you would also be working with the person to understand what is out of balance and what to think about their life. Another thing that seems to come up with chronic pain is people, when they ignore their own needs, seems to be quite a common thing. When they're thinking about everybody else but not about themselves, it's almost like the pain is asking them to think about their own needs as well. Stuff from the past seems to be quite often there with chronic pain, where there's something happened in the past that they haven't resolved, can't let go of, that they're giving a lot of their energy to, that they're really connected to in the present moment. Some need to move on from that. Sometimes I've also noticed people can find that there's some rewards from having the pain. Having the pain can bring sympathy. It can bring a feeling that they're being looked after, or maybe excused from certain things that they don't want to face or do. It could be that the pain is part of an unconscious strategy to deal with where they're at in their life. So I think there's a lot of different things, from purely physical, biochemical, to stress related, to emotional and psychological, that all get mixed up and can end up. This is not just for pain, this is for any health problem actually. If you're talking about arthritis or which obviously is pain, but all sorts of health problems usually have different levels of things coming together to result in the health problem occurring. But particularly for pain, those are the things that I've noticed have come up. So I might start asking people questions like, about their work, about their relationships, about are they being true to themselves, about how they're living their lives, is there things they want to do that they're not doing, is there things that they want to do that they're afraid of doing. All those kind of questions would be part of a consultation. So when I first see people, I would probably spend about an hour and a half with people, talking to them about their life, about their medical history, but also about their kind of life history as well, and build up a picture of where the imbalances are. And the treatment, as far as the treatment I would give them, would be partly herbal medicines, partly creating a space for that person to talk, and maybe also some practical things that they can do themselves to help with where they're at in their life. I got a call off Radio Newcastle. They obviously knew this thing was happening tonight and they wanted to ask me some questions. And apparently I was actually on the radio, but I haven't heard it. I don't think I will. But one of the things that they asked, which is something that you do keep getting, if you're a herbalist or something like that, one of the things that keeps coming back is, well, isn't it all just a placebo effect? It just seems like people quite like to put down alternative medicine by saying, well, it's all just a placebo. It doesn't really do anything, which is an interesting thing to think about. I suppose with herbal medicine, it's harder to say that because a lot of conventional medicines have their roots in plants anyway, even now. And it was only 100 years or so ago that nearly all conventional medicines came from plants. So there's obviously chemicals in plants that have a direct effect on the body. But the word placebo is also really interesting because I think it's used to diminish the value of sitting with somebody for an hour and a half and talking to them and giving them space to share what's going on in their life. And I think that's a really important healing process, and then a really important interaction between the herbalist or whatever else they might be and the patient. And just that exchange of words, that exchange of just respecting the person and giving them positive energy and a space to share their story, I think is a really important thing. So placebo, I don't exactly know what it means, but if it means the non-medicine part of a treatment process, well, I think that is really important. So I'd say that is as important as the medicine. And I don't think that devalues the medicine, but I think it just makes the treatment a rounded thing, and you've got to have both, I think. If you go, particularly with chronic health problems, with more acute problems, maybe you can just go straight in with a medicine and there isn't a big complicated story to unravel. But when you're looking at a chronic health problem, which is something that's going on and on and on and is very difficult to resolve, and it's built up over years, and there's a whole host of complicated interlocking symptoms and causes, then time to talk is really valuable and is part of the healing. Okay, so now I'm going to do something a bit strange. One of the things that I do with people in consultation sometimes is a relaxation breathing exercise, and I think it's particularly relevant to pain. It's also really relevant to things like panic attacks and anxiety, but it particularly works well with pain. So I'm going to do it with you. I'm going to ask you to try it. So basically what I'm doing with this, it's a bit like a meditation thing. If you don't want to do this, keep your eyes open. I'm going to ask you to close your eyes in a minute, and I'll just talk you through it. It'll only take me 5 minutes. If you don't want to do it, just keep your eyes open and think about something totally different. But basically the idea of the process is that we all tend to think that who we are is our mind. Our thoughts are who we are. We're kind of very locked into our minds. But the idea of this process is that you're learning that you can give your mind attention, you can listen to your mind chattering away, or you can place your attention somewhere else. You can place it on your breathing, for example. So actually, who you really are isn't your mind. Your mind is just part of who you are. Who you really are is almost your attention, or the part of you that decides where your attention goes. And the purpose of the exercise is to learn that you can take your attention away from your mind and place it somewhere else. But equally, you could take your attention away from your pain and place it somewhere else. So it's actually just learning to get a little bit more control over what's going on. And I think, again, with pain or other chronic health problems, there's often a sense of not having control, being out of control. And giving medicine to someone on its own is a bit like helping them to feel not in control, because they're then relying on the medicine. I think it's really important that people also feel that they're learning to manage something by themselves rather than just relying on a medicine. And that's another fault, I think, with our conventional medical system, is that we're very much, we go in there and it's done to us. We're not generally helped to think about what we can do ourselves in our lives and our diets and everything else to resolve the problem and to stay healthy and restore our health. So anything you can do to give people that sense of being able to do something for themselves is really useful. And I think this can be really useful, as I said, with pain, but also panic attacks, anything like that. So if you want to join in, close your eyes and I'm going to talk you through it. It'll be nice and relaxing and it won't take me too long. So I'm going to sit down while I do this because it's easier for me to do it. So I just want you to start by taking a few really nice big deep breaths. And then just become aware of your body. And notice where your body touches the chair, where your feet touch the floor, and where different parts of your body are touching each other. Then become aware of the sounds you can hear around you, those in the building and those nearby and those as far away as you can hear. Then And become aware of the floor beneath your feet. Just sense the stillness of the floor beneath your feet. And just try and get a sense of the ground beneath the building, the stillness of the ground. Hold your head nice and upright, stretch your neck upwards towards the ceiling, and the idea is to feel really focused, not sleepy. If at any point any thoughts come into your mind, I want you to gently turn your attention away from those thoughts to whatever it is that we're focusing on. Your mind doesn't like to be ignored, so it will start sending thoughts your direction. It will start telling you this, that, and the other, but just gently turn your attention away from it. And now I want you to focus on your breathing. And I want you to notice as you breathe in, the air touching your nostrils feels relatively cool and fresh. And I want you to draw that air right down into the center of your body. Imagine there's a balloon in your stomach or abdomen that fills with air as you breathe in. So you expand your abdomen on the in-breath, drawing in that cool air into the center of your body. And on the out-breath, just relax the abdomen and notice the air as it leaves your nostrils is warmer and more moist. So just try and be aware of the difference of the cool air as you breathe in and the warmer air as you breathe out. If any thoughts are coming into your mind, just gently bring them back to the breath. Bring your attention back to your breath. And again, focus on that cool air that you're breathing in, drawing it to the center of your body, and also being aware that you're breathing in oxygen your body needs. And just imagine you're breathing in vitality that your body needs. You're breathing in what your body needs to be healthy and alive. As you exhale, just being aware you're releasing carbon dioxide you no longer need. But also as you breathe out, just release any tension in your body. Anything you need to let go of, doesn't matter what it is. Any feelings, thoughts, anything. As you exhale, just have a sense of letting go with the breath. So you're breathing in what you need and releasing what you no longer need. So with each breath, just allowing your mind to still and your balance to be restored. So you're using the breath to nourish yourself and restore your balance. Again, if thoughts come into your mind, just gently bring your attention back to your breathing, to that balloon in your abdomen, expanding your abdomen as you breathe in. As you're breathing, still being aware of your body, still feeling the floor beneath you, the ground beneath the building. Still holding your head upright, breathing from your abdomen. Just try to gently keep your attention focused on the breath. Each time it wanders, bring it back, gently back to the breath. If you once again become aware of your body now, notice where different parts of your body are touching each other. Feel the chair that you're sitting in, the floor beneath your feet, and listen for any sounds you can hear around you. And then when you're ready, open your eyes and return to the room. So how did we find that? Did you find that you managed to keep your attention focused on the breathing? Yeah? Did anyone find that their mind was really chatting away and it was really hard to keep focused? Yeah? Okay, if you practice that really regularly, what you'll find is that you get much, much better at focusing your attention, you'll be able to just click into the breath and the mind will go right into the background eventually. No problem at all. If you imagine you've got pain shouting at you really loudly, it's maybe more of a challenge to take your attention away from that and focus on the breath. But it's possible to some degree, and sometimes to quite a large degree, to do that, particularly if you keep practicing. But the other thing that happens, if you give yourself that space every day just to be still and breathe properly from here, it gives you a kind of certain calmness about your life in more of a way than you might imagine it would. And maybe the chance to step back a bit from your life and just reflect on it. And as I say, with complex chronic conditions, your life is probably mixed in with that condition. So the more you can reflect on it and think about maybe the changes that might be useful to make, the more you'll help to unravel the things that have come together to create that condition. So that's a little bit, hopefully, an idea of what would happen in a consultation, and maybe my approach to helping somebody, give them some of the power, I suppose, to think about what they can do. And I think it's, as I said, it's really important not to ignore all that stuff because it is part of what's going on. Now, thinking about the herbs that I might use, there's no standard treatment for treating chronic pain in herbal medicine. You're very much looking at the individual person. So you'd be looking at what was going on in their life in the years leading up to the development of the chronic pain and what imbalances existed in their health, and helping resolve any imbalances that they have health-wise other than the pain, because they will all be linked together to some degree. And you're just trying to move that person into a state of greater balance. And it might be through nutrition, but herbs as well. So there'll be a certain proportion of herbs that I would want to give someone that would relate specifically to their state of health and well-being. They would then probably be put in a prescription with some other herbs, 1, 2, 3, I don't know how many, that would help calm the pain as well. But it is probably worth saying there's nothing I can give somebody with severe pain that is as strong as what a GP could give. Although what the GP could give may well come from plants originally, opiates, for example. What I give will calm the pain, calm the nervous system, and probably, but more importantly than that, will hopefully help resolve some of the underlying imbalances that might be related to the pain existing. Having said that, there are herbs that do work really well as anti-inflammatories or painkillers. So I'll say a little bit about some of those. There are a number of herbs that you can use as analgesics, painkillers. As I said, opium, opiates, cannabis. I was doing a bit of research just wondering about cannabis and how widely that was used. And apparently between 7 and 15% of people with chronic pain take cannabis. It's obviously illegal in this country. I think in America, maybe in some places it's not. But it obviously has some ability to help that person deal with pain. And I don't know what that reason would be, whether that's because it acts as an analgesic, but also maybe it slightly alters their state of consciousness, and they focus less on the pain. So it's an interesting thing. Is it actually, how is it reducing the pain? And it raises, I think, an interesting area that your experience of pain is partly to do with what's coming up through your nerves to your brain, but it's also partly how you perceive what's coming to your brain. And your perception of the pain, I think, is really important as well. So, I mean, that's a whole other interesting area. But anyway, the opium and cannabis, two kind of herbal, plant-based, fairly strong analgesics. There's another herb called valerian, which I've brought some along, and it's got quite an interesting smell, so I thought you might like to smell it. Do you want to pass them around? This is a plant that is, This is a plant that's a native to this country, valerian. It's grows in the northeast, likes damp places, but it's the root that we use. It's a really good, I can smell it from here, it's kind of, you'll smell it long before it gets to you. It's a really useful plant in terms of calming the nervous system, and probably in our country is probably one of the strongest nervines that we've got. But it also is an antispasmodic, and it also a relaxant nervine. So if you give that to someone, it can help promote sleep. It's very good for promoting sleep, but also taken at smaller doses during the day can actually just calm the nervous system and ease pain. Willow bark, we got this lovely display which I know Nicolette's going to say something about shortly. Willow bark is where aspirin was originally derived from. The bark of willow made into either a tincture, which is a liquid medicine, alcohol-based medicine, or you can boil up the bark and give that as a tea, is a really good painkiller. Interestingly, aspirin, if you take aspirin, it can irritate the digestive system. If you take willow bark, right, the whole thing, you get the salicylic acid that aspirin's made from, but you also get all sorts of other constituents, and it doesn't irritate the digestive system, but can work equally well. And a herbalist would tend to always use the whole plant rather than just a chemical from the plant. And there's one thing I meant to say at the beginning is, I'm not really an expert at all about the chemicals that are in plants. I'm far more interested in the whole plant, so I don't really go into too much understanding all the different chemicals and the effects they have on the body. I'm more interested in the effect of the whole plant, although no, it is very interesting to look at the individual chemicals and what role they might have. Another interesting thing, analgesic, is capsicum, chili, red chili. I've got 2 jars of cream that I make up for people, which can be really useful with pain. These have got chili in them. They've also got some essential oils, camphor, wintergreen, cinnamon and ginger, which are all warming essential oils. The ginger is the cinnamon's a tincture, the others are essential oils, which I'm happy to pass around. Because there's chili in it, if you want to rub a bit on, you can, but just be careful where you put your fingers afterwards, because if you get it in your eye, you'll know about it. But have a smell, then if you want to put a little bit on, you're very welcome. So the capsicum, I think it works by, firstly it brings the blood, it slightly irritates the area and will bring the blood to that area, but also it seems to stimulate the sensory nerves and then overstimulate them, and then they stop working properly. They deplete themselves with their transmitters. I think it's the transmitters. It might be there's an exchange of ions that goes down the nerve. It could be that gets depleted, but they stop the sensory nerves working as effectively. So applied externally, that it can work quite well for chronic pain, joint pain, muscle pain. And another interesting herb is St. John's wort. This is an oil. So the herb St. John's wort has been soaked in oil for about a month. It's a green plant with yellow flowers, but for some reason it produces a lovely red oil when you soak it in the oil. And St. John's wort is really good when there's nerve, it's strengthening and tonic to the nervous system. So if there's imbalances in the nervous system, it can help encourage the nervous system to work more normally. It's active against the herpes virus. So if you've got, I forgot the name of it, someone remind me, skin herpes, not a cold sore, shingles, thank you. If you've got shingles, which can be incredibly painful, the chili can work quite well, but also if you rub St. John's wort oil into the area, that can also work quite well. And you can also take St. John's wort internally to balance the nervous system and against the herpes virus. Lemon balm is also active against the herpes virus, just out of interest. Okay, this is straight out of my kitchen cupboard. I just thought it was the best way to show you it. Turmeric, Indian herb, Indian spice. Turmeric is a really excellent anti-inflammatory. In India, the old men in India will tend to mix turmeric with milk every morning and take it as just a tonic, really. But what it's very, very good for is if you've got any inflammation in the body. And taken on a regular basis, and you can use it really regularly, it can be really good for joint problems, but any inflammation in the body. And you can take it as a powder mixed with milk. I would tend to give a tincture, which is an alcohol extraction of it, just because it's very easy for people to use. Okay, what else have I got to show you? Another herb that's really useful, I haven't got any here, is Devil's Claw, Harpagophytum. It's another really good anti-inflammatory. It's not a native to this country. I think it's from Namibia. But it's been shown, it has been trialled and been shown to be an effective, not for everybody, but can work really effectively as an anti-inflammatory. And you'll find, when I say not for everybody, some herbs seem not to suit some people, and you've got to find the right herb for the right person. So just talking to them gives you a sense of what might be the right herb. Another really good antispasmodic is Viburnum opulus. Nettle is quite a useful herb that I might sometimes use. It's really good for joint inflammation. Sometimes with arthritis and rheumatism, a build-up of acids in the joints, an overly acid system can be a problem, and taking nettle to clear uric acid from the body can be really useful. So we're not just talking about suppressing the pain, but thinking about other approaches that might work. So, I mean, that's probably some of the main ones I would use. And as I say, I would combine those with herbs that were particularly relevant for the person, and combine all of those medicines with the consultation and talking to the person. I think I can't overemphasize how important I think talking to the person is, and understanding their life and working with them. It's a bit like going on a journey, really. I think someone walks in to see you with a health problem, pain, whatever it might be, and you embark on a journey. You embark on a journey of trying to understand how this person has ended up in this place that they're at in their life, and all sorts of factors will have got them there. So it's both of you working together to come to that understanding, and then it's a journey of making changes. Quite often, it's usually about making changes. What changes can be made in the body with the medicine, but what changes can the person make in their life? And again, it's working together to achieve that. So I think you can see that it's quite a different approach, really, to conventional medical approach. But as I say, I think it's got something really important to offer. When I was driving down with Nicolette today, we were just thinking about the cost. If that was on the NHS, how much would it cost for someone to sit with somebody for an hour and a half, herbalist, whoever it might be, and go through that process? And then if you start thinking about the cost of some of the medicines that are prescribed, and then the cost of people maybe being ill for much longer than they need to be, if that process will help them sort out their health, you actually could find spending an hour and a half with a patient could actually save quite a lot of money, possibly. But I think if we could bring that into the way we approach health issues, it could be really important, in all sorts of different ways, but particularly with pain. And I think that's about all I was going to say.
Some of the herbs you showed us look fairly simple. The turmeric and the St John's wort, which you can make yourself. How beneficial do you think it is to the clients where they can actually create their own medicine?
I think it's fine to create your own medicine, and that's part of what herbal medicine's always been about. But I also think, even being a herbalist, if I had a chronic health problem, I would want to go and see someone else, because I think it's very hard to step back from your own life and understand what's going on. I think it's really useful to have somebody to help you do that. So whilst it's really good, I think, for people to go out there and make medicines, and I run courses to teach people how to do that, I think for chronic health problems it's really good to see somebody.
Thank you for a really interesting talk. I very much enjoyed it. I just wanted to pick up your point about the placebo effect, actually, specifically, because I think people tend to forget that there is no therapy up to and including surgery that is not affected by the placebo effect. So to waggle the finger at anyone with therapy is a bit of a nonsense.
I agree.
Really. There's a lovely book by Daniel Mormon called Meaning, Medicine and the Placebo Effect, which is very well researched and has certainly changed my view.
Okay, thank you for that.
How do you manage interactions?
Interaction between herbs and conventional medicines?
Yeah, between herbs, are you aware of any interactions, and how are they managed?
I think I've not come across, in all the time I've been practicing, I've not come across interactions where chemically one herb interacts with another, but what I would say is when you mix herbs together, they all need to work in the same direction. So if, for example, somebody's trying to get to sleep at night and you mixed a stimulant with a relaxant, then it wouldn't work, or it could have an adverse effect. So the prescription you make has to have a common goal and direction. As far as mixing different herbs, as long as they're based around a person's needs, that I've not come across any interactions.
Your point about the fact that traditional medicine, conventional medicine, many medicines come from plants, that's absolutely true, and some of the most toxic medicines we use in current practice have an origin in plants or derivatives of. So how do you QC what you've got there? I think it's one thing QCing a whole plant, but when you've got herbal material, what is the process of ensuring that it is what you think it is, and that there aren't any compounds in there that are likely to cause damage?
Okay, if I make the medicine, if I collect the herbs myself and make a medicine, then I know, I'm just very careful about what I collect, and I know the herbs very well, and I'm careful where I collect them from. If I buy in the medicines, which I do for some of them, you just have to buy them from a well-known, proper supplier, because it's Western herbs that I would generally buy. I think there's less likely to be any problems. If you're buying them on the internet, you may be much more likely, from some company that you don't know anything about, you're maybe more likely to have issues. A lot of herbal suppliers will actually grow the herbs in this country nowadays.
I wonder if we could ask Nicolette to explain to us the beautiful display you've got over there, and that might give us a chance to think of a few more questions. Would that be okay?
Yeah, that's very good. To answer your question just a little bit though, most extracts that you would buy in a health food store are standardised to the mix of the compound that they want in it that's active. But plants can contain up to 400, up to even 1,000 different chemicals. Maybe the most active ones are between 40 to 50% of the extract. So, but it's a really interesting question, and it's one that's even more important now, and with the regulations on herbal medicine, which has just changed. So it's now really difficult to sell a herbal product that isn't regulated and hasn't been approved. So here, yes, this is our anodyne bouquet from just around the corner in Dilson Physic Garden. So these are all the plants that are out currently in the northeast in our climate, that have been used traditionally for thousands of years, hundreds of years, thousands of years, hundreds of years, written in medical herbalist books for pain. So in Dilson Physic Garden, there's over 800 medicinal plants that are used for all sorts of things, and it's been going about 10 years, and we've collected data not only from conventional clinical trials and pharmacological profiles of a plant, but also looking at the traditional use over many hundreds of years from the herbalists. And you can get all sorts of uses from their magical, mystical uses down to their actual chemicals and what they do. And there are actually over 40 plants at Physic Garden that are used for pain, or have been, or reputed to be used for pain. And here we have some of them. There is a handout that you can take home later if you're interested. And there's also leaflets on the Physic Garden, because we do lots of courses. So if you want to discover more about herbal medicine, then you can do so there. So something you may be more familiar with conventionally is this one here, which is your opium poppy. So that's where you'll be getting your morphine from. And the white willow, which was talked about, so the white willow bark is used in herbal medicine and also has less side effects than aspirin, so it doesn't disrupt the gut like aspirin does. So that's really fascinating. And there's bamboo, there's many have got many clinical or data behind them. Bamboo is one of them. There's fir, lavender, which is a relaxant, cabbage, cypress, oregano, snowdrop, as proven, there are only 8. So there's a huge, vast gap here in all of this, getting down to the hardcore science. So arnica, which is one you'd have heard about a lot in homeopathy. Now, the homeopathic evidence is actually not being clinically proven. It has been trialled, but it hasn't been found to be clinically effective. But arnica itself has topically as an anti-inflammatory, reducing edema, and it contains a compound called helamine and other analgesic and anti-inflammatory chemicals. Belladonna and mandrake. Belladonna, the one from the eye with the beautiful yellow flowers that drop down that lots of people have in their garden, contains atropine, which blocks your acetylcholine transmitter system, muscarinic receptor antagonist, and it's the different type of your pain relief. It's your awareness of it and where your attention is. Butterbird has clinical evidence for migraine treatment. It contains a constituents called petazine. They're all kind of weird words. They don't mean anything to anyone, so I don't necessarily need to go into them. But it has inflammatory effects like leukotrienes and prostaglandins, and is also a spasmolytic. And chili pepper, the one you'll all be familiar with, contains capsaicin, which acts on substance P and the vanilloid receptors. Fennel, which has limited clinical evidence for dysmenorrhea, which is this one here. And feverfew is quite a lot of evidence for that, for migraine, for helping with migraines and reducing the pain there. And then you've got your opium poppy that we've talked about, and willow. So those are the very few that actually have clinical evidence behind them, and there's a real lack of it, really, because there are probably a lot more plants out there that contain many, even maybe exciting compounds that we're just not aware of yet. So, and the interesting part of it is why these plants come to produce these chemicals. Why do they produce it? Because a lot of chemicals are produced in plants to deter predators, so they'll have a bitter taste. But no one really knows why they produce painkillers, except there's one thought that possibly it's to attract pollinators because it makes them feel good when they go away. Who knows? But the main question here is it better to take the plant or the chemical? And there are arguments in favour of both. That's for everyone to decide in the future to tell us, I suppose.
When you spoke initially about how you had your consultation, went through the person's life and so on, and you were contrasting that with the doctor, hello, here's a pill, goodbye. I'm not a doctor, so I'm really got a bad name. So I'm not defending the medical profession, but what you were saying seemed to me to be what a conventional doctor would do, given time and money. So if the Queen or whoever it was, like with limitless money, presumably a conventional doctor might go that way. And a lot of what you were saying seemed to be counselling or so, and it was a long way before you got to what might be the plants as opposed to the chemicals. I was wondering quite how far down that track you had to go before you died, you and the average doctor would die with it.
I think I agree with you. I think doctors would like to spend more time with patients, given time and resources. I think there is a difference in philosophy between what I do and what a GP or a doctor would do in terms of more of an emphasis in the herbal approach upon the links between systems of the body and lifestyle and health problems. So I think maybe that demands more time when you're looking at that.
What do you mean by the systems in the body?
Well, for example, I mean, in conventional medicine, you'll tend to have a specialist in the cardiovascular system or a specialist in the urinary system. So they tend to be seen quite separately, and often maybe links are not made as to how one is influencing the other. Whereas I don't have the depth of knowledge of a specialist in the cardiovascular system. They've got infinitely greater knowledge about the workings of that system. But I think what someone coming from a more holistic perspective can offer is the ability to work with how these things link together and how one's affecting the other, maybe in different ways.
Yeah, I wasn't sure whether you meant that sort of system or whether we're going to be almost to the very beginners.
Yeah.
There's one question here.
Can I just ask how popular paediatric herbal medicine is, and is it an area that's totally different to adults, and is there a comparison in the medicines that you use, or are they very different?
Almost the same. I mean, I work quite a lot with children. My own children, I've always given herbal medicines to. It's more about dosage, but it's the same process.
I had to didn't help my father who was suffering from cancer and shingles, which was chronic pain, and conventional medicine didn't do for a while. And I can see your the breathing technique, which I've used with children with attention deficit. What you're doing there is you're taking the panic out of the pain. Which is very important, because when a doctor gives a patient tablets, he often hasn't time to do anything else. And I can well see that had my father had somebody who could have had the time with him, which they never did have, that would have been very therapeutic and would have made a big difference to how he could have handled the pain. The other thing is the chili ointment brought back memories of myself at the age of 3, the NHS, and a solution to chilblains, which I'm afraid didn't work. Supposedly, I presume, it was supposed to increase the circulation.
Yeah.
I think singing Glory Hallelujah would just about put it right. But yes, I definitely think time is very important for analysing.
Absolutely.
Yeah. Can I? Oh, please do. Just catch the sound.
In terms of line of management, do you find yourself being the first line or the second line? I mean, and in terms of people wanting to manage pain, do people come to you as the first line or second line? And as a follow-up to that question, do you work closely with conventional doctors in terms of when it comes to pain as well?
I think some people it's a second line. Some people come in to see a herbalist because some conventional medicine isn't working for them, and they're kind of desperate and they're looking for other things that they can do. So some people come through that route. Other people, I think, come because they believe in herbal medicine, and that's the form of treatment they want to start with. Or and other people combine the two. They're doing the conventional, but they also want to. They may be using conventional painkillers, but they also want to be doing something to try, particularly for those conditions like pain associated with conditions that are quite hard to pin down, fibromyalgia or ME, and pain associated with those kind of things, where conventional medicine really struggles to understand what's going on, and they may be looking for a form of treatment that helps them understand and deal with those more complex underlying issues. And I've forgotten the second part of the question.
Do you communicate
With the GP? To some extent, I think there should be more communication. I always ask my patients to tell their GP what they're taking. I occasionally will write to a GP if I think it's important, but there's not a great deal of communication and quite a lot of mistrust from GPs about what I do.
You mentioned that you'd like to see herbal medicine as part of the NHS treatment, and obviously with cutting costs within the NHS and really looking at the effectiveness of the services, how could you kind of prove to the NHS that there would be some improvement in terms of patients and the pain?
That's a good question. There's probably not enough research happening so you can actually prove those kind of things. I think what herbalists and other alternative therapists are doing is largely happening without proper research. There is a process happening where, particularly in herbal medicine, statutory self-regulation, where it's kind of being brought under more of a conventional system of regulation, and hopefully with that there'll be more research. But I agree that something's not going to be accepted unless it can be proven to be effective, so there needs to be proper research.
There's one more question here.
When you produce a medicine to give to somebody, do you give it for a specific length of time, or do you advise that that'll be something they'll take long term, or do they just take it when the symptoms are a problem? How do you tend to sort of manage the amount that they take and the duration?
It would obviously depend on the person and what the problem was. I would tend to give the medicine until there was a shift, an improvement, and if there wasn't an improvement within a certain amount of time, and again that length of time would depend on what it was we were treating. Some things you would expect to respond quite quickly, other things would take much longer. But if there was no improvement, you would stop the medicine because it wouldn't be working. If there was some improvement and there was an ongoing gradual improvement, you would continue the medicine. If it was an ongoing gradual improvement but then it stopped improving, you would either change the medicine or assume that's as far as you can get with that line of treatment. So there's no definite answer to that. It really depends on how things... Yeah, you'd have to.
It's that reliance again, isn't it? It's trying to avoid the reliance on
Absolutely.
being the reason for improvement, and not the lifestyle changes or
Yeah, absolutely.
management strategies that they're all.
You'd always aim to stop giving somebody medicine.
Yeah.
And at any opportunity you would try to reduce the medicine, see how they are on a lower dose, and if possible stop it. But you obviously can't do that until they're ready for that to happen.
Thanks for the talk, it was really interesting. You seem to emphasise a lot on well-being, psychological, lowering stress and things like that. I'd be interested to see what you think is, do you think it would work if you took that side out of it and just add the herbal medicine? Also, do you think it would still work if you had that side of it, just the conventional medicine?
Okay, yeah. If you took out all the lifestyle stuff and just had the herbal medicine, you would get some improvement. But if somebody's doing things in their life that are creating the problem, so that's pushing this direction, and you're giving medicine that's pushing this direction, you might go back a bit, but you're only going to get so far. If you do both together, you're going to move much more quickly in the direction you want to go in. So if you just did the lifestyle thing and the conventional medicine, that would be a huge improvement on just doing the conventional medicine on its own, I would say. And it depends what the conventional medicine is and what it's doing. It may be that it isn't dealing with some of the underlying causes, it's managing the symptoms. I think it's really important that you have to treat some of the underlying issues as well. So
Which would, I think, come from the well-being.
Yeah, absolutely.
Because I would probably say it's more, I'm not against herbal medicine and whatever works for the person's chronic pain, but it seems to be more the psychological stress.
No, I agree with that, but then in some health issues, for example, you would employ herbal tonics, so you might use herbs that are tonic for the liver. I don't think in conventional medicine those kind of medicines exist, where you're strengthening systems. You're usually trying to push something in a particular direction with a medicine or replace a chemical that's not in the body. You're not generally giving tonics to move the system into a state of balance, and I think that's what herbal medicine can offer.
I mean, just to carry on with that question, there is a lot of clinical evidence behind herbal medicine, so they're just the same as there is with a drug. So the one when we were talking about willow bark, so it's white willow bark and it's an extract of it. And when you get that alongside aspirin, it has the same pain-killing effect as aspirin because it is aspirin essentially. So herbal medicine does have its foundation in science, and it just takes a holistic approach that is not only about treating maybe a medical disorder, it's about the health of the whole patient, which is kind of critical and to us, and is and I think that's where you're coming from, and it just has a huge side of it that is that, but it does use medicines. I mean, it's where all medicine is based from, so there are chemicals in there that do act on the systems in the body that do work. So.
Joanna?
I just wanted to know if there was any side effects to the medication that you give people.
Again, I generally don't come across side effects. They tend, I mean, herbal medicines can be quite strong, and if you give too much to somebody, they can be overstimulating, for example. I think when I first qualified, I gave somebody too much of a herb that was stimulating to the digestive system, and it ended up causing some irritation to their digestive system. I think if you get the dosage right and the herb right, you shouldn't get side effects. It's very, very rare. I suppose the other thing to say is that in the same way people can have a problem with particular foods, you can occasionally get someone that a particular plant doesn't agree with them. So, but other than that, generally no.
Why is it then that certain herbal medicines are not recommended for pregnant women? I've heard St John's wort is not considered to be.
Just like I was saying before, the herbal medicines, they are medicines, so they do contain drugs. So just like any drug, you have a dosage and you don't overdose, and there are contraindications in pregnancy, and there are also contraindications in other disorders. Cardiovascular disease, for example, is certain drugs that you can't take, and certain conventional drugs that you can't take alongside some certain herbal medicines. So they have to be treated with caution, and you should always ask a herbal medicalist before taking any herbs. You should always consult one, because they certainly do have contraindications, and it's something that is really important, and that I find particularly important for GPs to be aware of, is the fact that there are contraindications, for example, that can cause bleeding with certain interactions with other drugs, and that patients often don't mention what herbs they're taking because they think that they're just like a plant that you can have as a tea, which many of them are, because they are a food stuff. But it's also important for GPs to become aware of them because of that.
Okay, seems to have reached a natural point where I sort of decided it's near the end. I think at that point, therefore, we should just thank Nicolette and Ross for their contribution tonight. But before we do that, thank you also for your contributions, because that's really made tonight very special, very important.